You need to prepare for your dentistry or dental hygiene and therapy interview. These are super competitive, and so many people make the mistake of not preparing enough. There are different categories of questions, all the way from skills-based questions, values-based questions, to situational judgment scenarios. Skills-based questions can involve things like, tell me about a time where you had to problem solve alongside a team, or tell me about a time that you had to be a leader or you had to be resilient. You can answer this with one simple framework. That is the STAR method: situation, task, action, result, and then reflection. Remember, they don't care too much about what the scenario was, but your reflection on it and the actions that you took. NHS values questions are based around the NHS values, the 6 values, things like working together, everyone counts, respecting dignity. You should know these values inside out because they can be applied to lots of situational judgment scenarios. Situational judgment scenarios could be things about consent, confidentiality. What would you do if a patient refused treatment? What would you do if you saw somebody taking a photo of clinical notes? These are really difficult to answer, and you do need to learn the keywords and phrases. If you've got the dental hygiene and therapy interview guide, there are lots of questions and model answers in there, but I've got a longer YouTube video where I go into detail about MMI, panel interviews, common questions, and common frameworks to answer these.